Welcome everybody to Ecophysiotherapy Presents Health, Wellness, and Lifestyle. My name is Madeline Golick and I'm the owner and pelvic health physiotherapist here. And my guest today is Tasia. So welcome to the show, Tasia.
Thank you. Thank you for having me.
I am interested in having this conversation because you and I had met and you were mentioning some of the things that you do, and I had never heard of what you do, so I thought maybe we could have a conversation and let other people know. But before we get into exactly what we're talking about, I thought you could tell us a little bit about you.
Well, I'm actually born in Oxford, England. A lot of people think that I'm actually born in Southeast Asia, but I'm not. I moved to Singapore when I was pretty young, and I've lived there ever since, but my family is from all over the world. So my brother is English, my father is a New Zealander, and he lives in Australia, and my mum is Singaporean. So I have quite an extensive experience with different cultures and languages, and it's helped me a lot in everything that I do, actually.
Oh, yeah, I can imagine seeing different parts of the world and different cultures, and yeah, that's definitely got to come in handy.
Yes.
So I wanted to talk with you, or actually, I actually wanted to find out what got you working with the deaf and the blind.
So I've actually known how to sign since I was 16 years old. I met a huge deaf community when I was in Singapore, and I learned that. And I volunteered with the Association of the Deaf before I came to Canada. And it's always been my dream to work with the deaf community. So when I came here, I got myself into the Canadian Hearing Society. I worked with them for 7 years. And then I decided that I wanted to do more. I wanted to not be based in an office. I wanted to go out into the community and do a lot more. So I went and found out about intervention. The only place that you can learn what we need to do is at George Brown College here in Toronto. It's a very extensive program with regards to deaf blindness and deaf blind individuals and what we do in intervention. So from there, I've become what I've become, an intervenor.
Yeah.
Yes.
So having said that, like, let's define what an intervenor is, because I actually am not. When I was trying to like come up with questions for our interview, I was like, I don't actually really know what that is. I mean, I have an idea, but I'm not really sure.
Okay, so what we are is a bridge between individuals who are deaf-blind and the world around them. We are essentially their eyes and the ears. So what we do is we facilitate effective communication and receptive communication for them with whatever they're doing in their life, and whether it's with people or whether it's just their environment.
Right.
Yes.
Okay. And so are you just working with children, or is that adults? What does, like, who do you work with?
I can work with anybody. We're trained to work from the time that it's a child is a baby all the way to a senior. We're trained to work with individuals that are born deafblind and individuals who have become deafblind later in life as well. So that it's quite extensive.
Right.
Yes.
So let's maybe talk about you're born with deafness or blindness. So maybe walk us through, like, how do you help individuals? What would a intervening session or what would that look like?
So with children, say for example, I worked with a child who is born deafblind. So they wouldn't have a total vision. Usually, they wouldn't have a total vision and hearing loss. They would have perhaps some perception of vision. Sometimes they have lost central or peripheral vision, or they may not be able to see a lot of things. And they would also have a hearing loss. So we call that a dual sensory loss.
Oh, okay.
When you have a child with that, it's very difficult for them to acquire concepts and language. So we try and start from the very basics. So for example, if I were to talk about, say, teaching a child to brush their teeth, for example.
Okay.
We wouldn't just start putting a toothbrush in the mouth or just show them a toothbrush. We have to kind of start them along a little bit of what would the sensation of going anywhere near the mouth be. So we would start with something like the concept of having something near the mouth by touching them gently near the mouth itself. Start introducing later on, when they're comfortable with that, having something in the mouth by putting a finger in. And then we start adapting things like having toothbrush near them, the sensation of movement. So it's actually building on concepts. And then we get beyond to what time of the morning or what time of the day that they will be brushing their teeth. What is it for? How would we then develop upon it? And then we would extend upon the concept of why do we need to keep our teeth clean?
Right.
Building on the concept of going to a dentist. So that would be an example of what we would do as an intervener with an individual that's deafblind from a basically a very young age.
From a very young
Yes.
age. So is it when the parents find out that the child has the deficits that, like, is that when, or I assume obviously at that point that's when they contact somebody?
Yes. So
like
they
yourself,
would,
or
what they would do first, obviously, is go through, when they start understanding that the child is deaf and perhaps blind, they go through a whole gamut of tests with the hospitals.
yes,
And the hospitals themselves would then send them to, say, for example, Erin Oak, which is for children, where they start going into early intervention for specific programs. They would invite interveners to come in pretty early if it's feasible. There is a big grieving process for the parents at first, because they have
Right.
to understand that the child is not going to go through normal development as a child would, and the child may not react, the baby may not react to how a normal baby is going to react. So there's a lot of different things that are put in place on an emotional level as well as a physiological level for the child. And by right, usually when they start them early on with interveners, sometimes that may not actually happen. They may actually go through an Erin Oak. But we have a deaf-blind program in W. Ross, which is in Brantford. It's a school for the blind.
Oh,
and they have a
okay.
deaf-blind program. And once the child starts at that age, they actually enter into that program if they can't go into a public program in one of the public schools that don't
Right.
have special needs. Sometimes the children do go into their individual schools where an intervener is hired to come into the
okay.
school to work with them. But if they can, they would normally go into W. Ross. If they're in Ottawa, they have a different school, which is French-based.
okay.
Yes.
So where would you come into the picture? Are you going into school? Like, would you be working with somebody in a school, or would you be working in a home? Like,
For the schools, there are interveners that are hired to work with the school. So they work with the teachers and the educational assistants within the school. W. Ross does have interveners that go in, and what W. Ross does is they have the daily teachings and whatever input that the child needs. And usually the children stay at the school. They have a dormitory there at night so that they can teach them anything to do with living.
right.
Like how they would make their bed, how would they would get around, toileting, things like that. And they go home to their parents and their families on the weekends or for school holidays. That's what usually happens. And what they usually do is that the children are in the school till they need to start the transition to adult group homes. And they start that transition, I think, when they're 17 years old, and they stay in like an independent dormitory so that they can learn the transition to adulthood.
Right.
Yes.
What would be some key things that perhaps a parent might want to be aware of if a child is born, with limited vision or deafness? Like, I think you were sort of mentioning about the tactile. There's some, because they're not getting their sensory input from vision and deafness. How might a child sort of react to touch? Is there something that parents should be aware of, or something they should be doing with respect to that?
Yes. A lot of, I give an example of, when a mother has a newborn baby, when they actually have vision or sight, they can actually sense movement, even though they may have full vision. They actually know and anticipate that mother or father is going to approach them and somebody's going to pick them up, and they recognize that. With a child that is deafblind, they won't be able to hear or see anybody approaching them. So for them, it's kind of like a shock if you suddenly lift them up. They actually develop tactile defensiveness. And what a parent would then have to work through is making sure that they allow anticipation. As an intervener, one of the biggest things that we learn to do is to make sure that anybody that we're working with who is deafblind anticipates something.
Right.
So we give them the information so that they know what is about to happen. Whether it's through a touch cue, a visual cue, by presenting something using, there are many different methods to do that.
Okay.
We also provide motivation. so that if they have any goals, doesn't matter how young they are or how old they are, they have goals in whatever they do and present in their life. We motivate them to do that. Communication is a huge factor within intervention, communicating anything that we need to, whether it's in language or it's in emotion or behaviors, and confirmation that whatever choice they've made from whatever information we've facilitated for them, we've confirmed that they've actually gone on to do whatever they wanted to do. So we use that even with a little baby. We'll probably be doing that, and that's what we would work with the parents on doing. So with tactile defensiveness, what I was saying to you was that, say for example, a child is they have an issue with somebody touching them because they don't know. It's a very strange sensation. Who is this person? I don't recognize the smell. Especially if you're in a new place, say you're in a medical office where the environment is strange, the smells are strange, everything that's going on is strange. And if a doctor touches them in a certain way, especially with a stethoscope, it's cold, it's unnatural. They're going to react in a very different way. If you want the child to learn to adapt to massages to help with muscle structure and development. The sensation of being massaged, sometimes it can be painful and uncomfortable, but you also want to develop that so that if they go into strange situations, they're not going to necessarily start having challenging behavior. So these are things that maybe the parents can work on. It's a huge thing.
It's definitely not something that an outsider would necessarily think of. Even from a medical perspective or seeing a dentist, unless you're aware of that, you may approach just thinking like, well, this is just how I approach everybody. Right? But what you're sort of identifying is that these situations that we consider normal in this population, we need to prepare a child for that, or even prepare the healthcare provider or whomever's going to be interacting with the child, like, hey, this is sort of how we do it, so that the child isn't sort of spooked by the sensations, right?
And I would say it doesn't matter whether, for us, it doesn't matter whether it's a child, an adult, the same things would project anyway. Because I've seen individuals who are adults in their 90s and they react in the same way. I think another thing more with children is challenging behaviors, because if with communication, if they feel that apart from pain, like they're experiencing pain or discomfort, there may be situations where they are trying to communicate something, they're frustrated because you're not able to understand them, or they don't know how to communicate it. They want attention. There's so many different issues that crop up that then are reacted with challenging behaviors, and parents don't know how to react to that sometimes. Or if it's a brand new situation, they don't know what has triggered the child. And it's mostly about patience. And a lot of parents, because there may be siblings or they look at other children nearby, they find it very hard sometimes adapting to that. Right.
And an intervener could, to some extent, help with that, situation on finding ways for communication.
Yes, I think in especially in school situations, sometimes it could be just like a child with autism, something's out of routine or something may have triggered a child. As an intervener, because we really do work with that individual a lot, there may be certain situations that crop up that somebody else may not realize the child has reacted to, that we may note or have noted before, and we feel like Sherlock Holmes a lot of the time. We really do investigate certain things, and we may actually be able to figure out what is actually triggering a child pretty fast.
So I thought maybe we could now transition and talk about what about, deafness or blindness later in life? Do interveners get involved with that, with helping perhaps with their family members, or maybe it's an elderly parent?
Yes.
What does that look like?
So when you are born deafblind and when you become deafblind, it's a very different thing. When there are a lot of reasons why a person can become deafblind in life. One of them is Usher's syndrome, where you go through actually gradually losing your sight and your hearing. Later in life with seniors, there's glaucoma, hearing loss that comes about, retinal detachments. One of the biggest things with that is the bereavement factor. From a standpoint of a person who's had experience of vision and hearing, when they start losing it, they go through the entire grieving process. Not only do they go through the grieving process, so does the family. A lot of them go through things at different times. And when it comes to that, I think a lot of them go through an extreme denial. They don't understand what they need to do, or they're angry with the situation. And a lot of them don't come out of it very well. The family itself, what they need to do is to understand, because they won't understand what the person is going through. So they need to understand that they aren't seeing the person in the same way anymore. And that's where interveners come in, because what we do is we go out and we try and bring them into society the way that they used to. There are a lot of limitations that they perceive, but we try and make sure that those limitations are not getting in their way, and they actually work around and adapt with these limitations.
Right.
So I give you a classic example of a person who is now starting to feel isolated. When you start losing your hearing, just like with any hearing loss, say for example, a simple word, say for example the word understand. You and I would hear the word understand.
Yes.
But for a person who is deaf or having a hearing loss, they don't hear that entire word. So what their brain would hear would be something like "dus that," and then based on context or whatever the conversation is, the brain then starts to magically try and put the
pieces together. Yeah.
Same thing with the vision. If I have a loss of central vision or peripheral vision, my brain starts patching things together like a patchwork puzzle. What happens then is that it becomes exhausting for the individual, because they're working overtime.
Yes.
But on the other hand, the family members are seeing this individual as a person they've already known. So examples of situations are, this person goes into a family situation where they're having dinner with, like the sons and daughters, grandchildren, maybe it's a family party. Everybody's talking around them. There's a lot of things going on. There's a lot of noise. There's a clatter of, say, cutlery and things.
Yes.
And it's too much. So what happens with this individual is that, firstly, they're being isolated because they're not participating in this conversation.
Yes.
They can't get everything that's going on. Nobody's actually facilitating what somebody is saying. So what they do is that they just smile and pretend.
Yes.
And then with that, everybody thinks nothing is happening.
Right.
So they don't get the kind of connection that they normally feel. That starts with the isolation. They start withdrawing into themselves, and it leads to depression and a whole gamut of other things.
Right.
So as interveners, we go in and we try and motivate them to actually speak up for themselves. And if we can, we work with the family to try and make sure that they set themselves up for success with the family member.
Right.
So, for example, presenting yourself in front of this individual so that they can see a person's face when they're speaking, rather than speaking behind them or to the side. Then that person can at least try and, by the body language, by the demeanor, sometimes they have enough vision that they can actually see the mouth moving, facial expressions, things like that. And teaching the family members to slow down, to be very patient, to enunciate clearly, even in terms of the kind of speech that is used. Instead of using more complicated speech, to use simpler text with fewer syllables.
I was just going to say with less syllables.
Yeah. So things like that are incredible help to the individuals. It helps to make them feel that they're supported in everything they do.
So do you, because you also are a home stager.
Yes.
So in a population where a parent has vision or hearing loss, do you get called in sometimes to adjust the environment?
Not necessarily,
Okay.
because most of the time they would already have that environment.
Right.
What I would necessarily do is, and I think it just travels across the board when it comes to anything to do with design within the home. We would need to set up situations so that it's easily accessible, but I also have to factor in everybody else that may be living with them.
Right.
So I don't want to do everything so that the rest of the family doesn't function within the house, or it's not a pleasant haven for somebody within the home. So what I would then do is we need to stick with whatever the person knows in terms of the habits and routines, but we would present things in different ways. So say, for example, lighting. When a person starts having low vision, we would start making sure that there's better lighting within the house. But better lighting is not about just adding lights. It's making sure that there's contrast within the home, there's not too much glare or reflection off of walls. I would lighten walls in a certain way by using very light white colors or pastels. I would make sure that there's a lot of different light sources, but not too bright, because it's not about making sure it's bright, but making sure that in situations where they need the light, they have it. For example, outside light coming in that projects is an issue, not for you and me, but for other people.
Yes, yes.
So I would have to put in things like curtains, different blinds to set up, things like staircases, which are dangerous situations.
Yes.
I would then make sure that there's some kind of textural advantage for them to be able to sense. So either by putting in runners or changing the staircase so that the actual tread itself is dark, but the backboard is white, so that it can see the contrast between the stairs.
Right.
Things like the railing itself. If I didn't add, if I wasn't able to do that, I'll make sure that there's a runner so that they can tell that they're actually walking on a different surface. Things like furniture, I would make sure there's contrast between the furniture and a wall so that they don't trip over it. So if they had a light colored sofa, I would make sure that for that particular wall, if it's backed up against the wall, there would be some kind of a darker tone to the wall. Or I would put maybe a painting there so that they had a visual cue.
Right.
Even things
Okay.
like the doorways, I would make it a darker contrast so that if, say, for example, all the walls were white, they would be able to tell that they were entering a different zone or a different area. Even painting the door a dark color, it will be on trend, it would have a design element, but it
Yes.
would enable that person
To distinguish
Yes.
the difference between surfaces. Actually, that's a fantastic tip, especially for somebody like sort of listening that, is like, oh, I never even considered that as a possible. Like, I would have never considered using light and dark
Yes.
for contrast so that they may not be able to see, but they can see shading
Yes.
difference.
Well, I give you an example because you brought up seniors. So
Yes.
when seniors, they may be living in a house with you and I.
Yes.
In terms of like anybody in our age group. So say, for example, you have a kitchen with dark cabinets and you have dark counters and you may have furniture that is maybe in a darker shade. So what does a senior do when they're having a vision loss? They bump into things. They can't really see certain things. So what I would then do is make sure that the appliances were like in stainless steel, so there would be some reflection. I would put light items or decor on the counters, or even plates or dishes, or even tactile things that they could actually touch, that they could actually, in terms of depth, they will have depth perception.
Yeah.
If it was a white, a lot of us have white kitchen cabinets, then what I would do is I would make sure that the door handles are dark, so a dark color instead of stainless steel, so they can actually see the door handles and the contrast between the white cabinets. So you still have the design element there, you don't detract from that, but you allow the person, by giving them the respect as well, to make sure that you're not like focusing on the limitations.
Yeah, but just making it a little easier to,
Yes.
to move around
Yeah.
the home by just even making those small
changes. And
changes.
they're very simple.
So I can now imagine that, all this experience with your intervening, whether it's children, adults, really helps with home staging.
Yes.
Yeah,
Yes, it
and
does.
preparing the home, because then you're picking up on things that the homeowner might see as like, this is the best thing, best design, but you're saying you might be able to pick up, well, this is kind of actually taking focus away from what we really should be highlighting, and I imagine that comes in really handy.
Yes, it does. It helps in every way, not only in terms of perception, it's sensory perception when you walk into the home, because there's so many things that make it comfortable. It's not only about the visual and auditory perception, but about the senses. Every single sense is utilized when you're deafblind, and because I can pick up on all those small little details when I walk into a home, I'm looking at it from the perception of a potential buyer walking into the space. How would
Yes.
they feel?
Yes.
We want to tap into the emotions of that person when they come into the home, and not only am I working with the homeowner and the real estate agent to making sure that the stress levels alleviated, and that I'm working with them on their habits and whatever they're used to within the home, even though I may be changing around to becoming absolutely beautiful.
Yes.
But I also tap into what I think the homeowner, the potential buyer, is going to do when they walk in. How am I going to perceive that element and bring in that emotion? So there's so many different things that I've been trained in on a sensory and physiological and psychological aspect of it.
Absolutely.
Yeah.
That's amazing, and I think this has been a really fantastic conversation. I think we may need to do a part 2 later on. But just for our listeners, I just want everybody to know, if you want more information from Tasia, whether it's her intervening work or home staging work, her contact details will be available at the end of the show and in the description. But I want to take a moment now just to thank you so much for coming and letting us know about these services, because there's probably people out there that that really need it. So I appreciate it very much.
Thank you for giving me the opportunity to share everything with everybody.
Yeah.
Yes.
Great. So on that note, we'd like to just thank all the viewers, and until next time, see you later.
Thank you.